Frequency Podcast Network. Stories that matter, podcasts that resonate.
1 down, 10 more to go. Manitoba has become the first province to officially land a deal on Pharmacare with the federal government.
There will be a day, and make no question about it, when every Canadian in every part of our country has access to the medication they need.
That's Federal Health Minister Mark Holland making the announcement alongside members of the Manitoba government. The National Pharmacare program is only in its beginning stages, with the feds committing $1.5 billion over 5 years to make contraceptive and diabetes medications free. But the delivery of health care is a provincial responsibility, so deals are necessary to make this a reality across the country. The announcement comes right before an expected federal election this spring, which is also raising the risk this program may not survive. So why now? Can more deals be made before the federal writ is dropped? And do Donald Trump's tariff threats risk raising the costs of medications, not just for this program, but for all Canadians? I'm Cormac Mac Sweeney, and to answer those questions today on The Big Story, I'm joined by Federal Health Minister Mark Holland.
Thanks for having me, Cormac.
So you've been working on the Pharmacare issue for some time as a minister, your government as well. I think at least since your first term, you were studying a Pharmacare plan for Canadians. You now have this first provincial deal signed. How does that feel, signing the first provincial deal? And can you tell us what this deal entails?
Yeah, I'm elated. This is a huge, huge deal. We've been talking in this country for decades and decades about Pharmacare. This is the first concrete step. This is going to be people actually getting medicine. So it's been a long road, but Manitoba is the first. There's going to be others. Now, here in Manitoba, Cormac, they were already leading. So they already were out of the gate, the new government, in providing contraceptives and HIV/AIDS drugs, which is phenomenal. What we're doing with them is to be able to expand the full and complete range of contraceptives and diabetes drugs. And because they had a leadership position, we were able to use the money that would have gone to contraceptives to do hormone replacement therapy. So this is for women who are in menopause. It can be very, very difficult on them. And a lot of women don't have money to be able to take that medication. It has a devastating impact on their families and their ability to do their jobs or go through their lives. So this is a big deal, and it's an important starting point for a world we have to get to, a world where every Canadian has access to the medicine they need. And I'm being long-winded here, but I think why is that so important? It's not just important as a matter of social justice and affordability. It is important for those things. But it's because our health system right now, we wait for people to get sick and then we treat it, and it costs us boatloads of money. We need to be upstream. We need to get people the medicine that they need. We need to be identifying illnesses early. We need to be stopping things before they become serious. It's going to save us a huge amount of money. And that's what this is about too.
And just for our listeners, it's $219 million over 4 years for Manitoba, and that's a part of $1.5 billion that your federal government has budgeted over 5 years to implement the first stage of Pharmacare. But this doesn't come into effect for Manitoba until June, which is likely after the next election. Couldn't you have sped this up a little bit, especially since Manitoba already had a head start on this? Couldn't you have sped this up so that people start receiving that help and seeing that benefit right away rather than dangling it after the next federal election?
Or we're working on that. So there's, we're trying to get this done as fast as we possibly can. And I'm respectful of the provinces and their jurisdiction and what they tell me they need to do to get it right. But in Manitoba's case, we wanted to get this out the door, and we want to make sure that the date that we set is one that we can absolutely deliver on. But I'm happy to be able to say that we're working on finding a way to accelerate that further. For me, I want to see medicine in people's hands immediately. This has been, but the other thing I'd say here, Cormac, and people forget this, it is less than a year ago. In fact, it's a year minus one since we introduced this legislation in the House of Commons. It normally takes 18 months to 2 years to get royal assent just to pass legislation. Not only did we pass the legislation through the House, through the Senate, And not only did we work our way through the Treasury Board process and all of the internal mechanisms, but we got to the point of a signed first deal in less than a year. That is unprecedented. So, I know everybody's in a rush here, but we are moving at breakneck pace, faster than anything else has moved to get this done.
Even though you're moving that quickly, what's to stop the next prime minister or the next government from ripping up this deal or backing away from Pharmacare? Is there anything in the contract signed with Manitoba that would make it actually legally difficult for that to happen?
Well, it would have to be a vote of the House of Commons. This is a very different thing because we're not talking about a hypothetical. This is going to be pulling medicine out of people's hands. The conservative argument against Pharmacare that I've heard is, well, it doesn't exist. It's not real. Well, now it exists. It's real. And to take this away from people, I think, is going to be a very difficult bit of business. But certainly they may try. In our system of government, the test of good policy, Cormac, is always whether or not it survives the change of government. So, there's going to be a very important election in the not so distant future. It's certainly happening this year, where Canadians are going to have a choice to make around what kind of government they want. And the Conservatives have been clear. They've been clear that they don't support dental care, that they don't support Pharmacare. So if they intend on destroying this and they get elected, then it would be destroyed.
With all due respect, you say it's real, but it's real on paper so far. If it's not being implemented till June, people won't actually have that benefit in their hands, as you say. So will people actually notice that much if something's taken away when they never actually had the chance to see the benefits if we have an election before June and it is taken away?
Well, so as I say, we're working on accelerating that. June was a date that we put out because we want to make sure that we deliver it. And we're working with Manitoba. Hopefully, we're going to be able to accelerate that. But, even with a new government being sworn in on the fastest basis, they will be taking drugs out of people's hands. There simply wouldn't be enough time to reconvene swear in a government, reconvene the House, and pull this before people got drugs. Wouldn't be possible. So the reality is that they will be pulling drugs out of people's hands. And I would simply ask why. I mean, it's kind of a bizarre conversation for you and I to be having because the thing about getting people medicine, and let's take contraceptives just as an example, Cormac. In British Columbia, they brought in, they were the first to bring in a couple of years ago, free contraceptives for everybody. The early evidence is it's saving more money than it costs. And, diabetes costs this country more than $30 billion a year. And a huge part of that is that doctors are prescribing medicine patients can't afford to take. And what ends up happening is they wind up with a limb amputated or blindness or cardiovascular disease, or God forbid, they die. And that costs our system unbelievable amounts of money. So even if you aren't compelled by the social justice of a person who's sick getting the medicine they need, and I wish we lived in a world where that was the end of the argument there. Just looking at it, it's fiscal madness not to make sure that people get the medicine they need. Like, we have to break the wheel of how we manage our health system, waiting for people to get sick, waiting for them to get ill, and then spending egregious amounts of money to deal with their chronic disease or illness makes no sense. It is absolutely nonsensical. And so it is a bizarre bit of business that you and I have to expend our energy talking about what a conservative government might do to chop it up. Like, why aren't we talking about how we continue forward on this and get up the stream and make sure that people don't get sick and reduce costs in our health system and make people more healthy? It's an incredible waste of time, in my view. And I wish the Conservatives would get on board because conservative premiers and conservative health ministers I'm able to have this conversation with them. Like, we're making great progress in Alberta and Saskatchewan. So if they can get it, what the heck is going on with the federal Conservatives?
I will say it's not just the federal Conservative Party that has some criticisms. The Canadian Chamber of Commerce put out a statement arguing that this will force people onto a restrictive list of treatments. And they say instead of helping close gaps with private and provincial insurance, they see the feds as intent on implementing a full national pharmacare plan that they say will result in access to fewer drugs, worse health outcomes, and drastic increases in public spending at a time we need to be cautious with spending. So how do you respond to that?
Well, it's a bunch of malarkey, with all due respect. Look, the reality here is there's going to be nobody who gets less. This is going to be about people getting access to medication for free. And for the medication that isn't for free, they can continue to use their private insurance. And the idea that private insurance, is going to stop covering people? I mean, they're in the business of covering people. Now, the question for this country on a go-forward basis is how do we get everybody all the medicine they need? Now, it's very clear in countries in Europe that have public health plans that are where they provide medicine as part of those public health plans. They're very effective, and they operate on a model that costs less and delivers more. In systems that are private, there is a lot of gaps and costs. And I have been agnostic about a model, but what I said is we have in PEI, we have a mixed model that's based on filling in the gaps with a private system. This is based on a public system that is universal. Let's build a valuation around that. Instead of casting out ridiculous fear-mongering, which is what you just described, it's just nonsensical fear-mongering. We now have in the real world 2 different models delivering medicine, and we're going to be able to build a valuation around it so we can decide which model to go forward. And I would say that if the insurance companies want to be part of the solution, then they should be helping and cooperating to make sure that we find solutions. I think there are absolutely answers here to close this gap quickly. But I don't think it's helpful to engage in that kind of nonsensical fear-mongering.
A federal election could be called now within days. When will we see the next provincial deal? Will we see another province sign on to Pharmacare before Canadians head to the polls?
Well, Cormac, you look at my travel schedule, you can see that I'm in different provinces every day. I'm traveling all the time. So I'm working as fast as I can to sign these deals. I think we're going to have very good news very soon on for other jurisdictions. And I'm going to keep going until that writ happens. So I don't know, that could be weeks, that could be months. We know for sure it's happening this year, and I'm going full speed to get as much done as fast as I can. I think there's going to be very good news soon.
More on the big story with Federal Health Minister Mark Holland in just a moment, when we'll talk about President Trump's tariff threats and how they may impact the cost of your medication. I want to shift topics a little bit. It still has to do with medication for Canadians, however. President Donald Trump, on top of the many different tariff threats he's been making lately, has vowed to place import taxes on pharmaceuticals. Now, if pharmaceuticals do become part of a potential trade war, not just with Canada, but the European Union and the world, will Canadians see their drug prices potentially rise as a result?
Well, I think, one thing we have to recognize, this is a very dynamic situation. What is or in or out or being considered or not being considered it changes by the minute, let alone by the hour. Of what I would say, we're very clear to our American counterparts. We have a highly integrated supply chain that is mutually reliant on very, very delicate and tight constraints to be able to move goods and services back and forth, not just for medicine, but also for medical devices and supplies. And if that is disrupted, that is very bad news for both the United States and Canada. And so it's helping them have an appreciation for just how disruptive it would be to take actions like this. So I'm extremely confident that we're going to find a path forward because, look, in a trade war, and that's what we're in, and there's a movement on our sovereignty. But in a trade war, you can cross swords on a lot of things, but I think people's health, we've got to be very, very careful. Like, this is the kind of stuff that people's lives rely on. And so I'm very convinced that we're going to be able to navigate that conversation, because the impacts of disrupting that supply chain, it would be too injurious to both countries. It's just completely nonsensical. So, we're going to continue having those conversations, and I think people can be assured that reason will prevail.
But at the same time, during the first term of Trump, he did place tariffs on steel and aluminum while we were negotiating a new trade deal. So he could potentially follow through with this until a certain time. So in the short term, should Canadians potentially brace for higher prices and disruptions to medical supplies and potentially their drugs?
So I would say that, we're in a world of uncertainty, and that in a world of uncertainty, it's important to work from what you know and then move outwards. And so we're all planning our lives in this kind of chaos that's been kicked up by all of the uncertainty from the president making a number of different proclamations about what might or might not happen. I think that when you look at self-interest, right, and this is a very important guide in life. What is in the self-interest of the person you're now negotiating with? Our supply chain on medicine, on medical devices and supplies is so highly intricate. It has so little margin for error or additional costs on both sides of the border. And you're talking about people's lives. That I feel very confident that we're going to be able to protect this, and we're going to do everything that we can to protect it. And I think that sometimes you can create a problem by overreacting to something. And so it's important for us not to, start reacting to something that doesn't yet exist, because then you can create a movement or a problem that doesn't need to exist, right? So we just need to take this a step at a time. I'm doing roundtables with the biomanufacturers and all of the people in this space. Very, very close communication with them, talking regularly about what they're hearing, about what they need, about how we can defend them, how we can advocate them. And I feel very confident in that process. And I think Canadians should as well.
Fact of the matter is about 70% of our pharmaceutical exports go down to the U.S. So if there is a tariff or trade war, are we preparing with the industry right now to make sure that we're more buffered for a potential hit?
Yeah, I mean, so one of the things, Cormac, that we've been doing since the pandemic is really amplifying domestic production of everything, in the medical space. So certainly medicine, devices, and supplies. But it's interesting. These supply chains oftentimes will bounce back and forth on either side of the border for the same thing. Like it needs to go south, then it comes north, then it goes south, then it goes north. So it's so integrated, and stuff is moving back and forth all of the time. We're absolutely like not just Canada, but obviously businesses looking at the instability that this situation in the United States is creating and diversifying our markets more. Like I think during the pandemic, we were concerned about domestic production. We weren't concerned about, supply chain disruptions with the United States or about whether or not the U.S. market was a viable market to sell into. So all of this disruption is obviously changing patterns of thinking. And we're diversifying, not just in health. Like everybody's looking at how to diversify our trade portfolio, to look at it, to choose more stable lanes. And this is one of the things the Americans really have to consider here. When they're being so erratic and they're ripping up trade deals that were negotiated in good faith, then it starts to become a place where you go like, it's difficult to want to do business there because you never know what's going to happen, right? It's 1 minute it's this, and the next minute it's that. A deal that you sign in good faith gets tossed out. So, hopefully there's some consideration about the long-term impact of them comporting themselves in a way that is so erratic, because that is going to make it difficult for businesses to do, to work with them. So, I think the key thing here is to just approach it on the basis of logic and reason and say, like, we want America to do well. Like, we want America to be successful. We want their economy and their businesses to do well. And we want our businesses, first and foremost, also to do well. Those are not mutually exclusive things. In fact, they're very intertwined. Our success is their success. Their success is our success. And so we've got to be focused on ways to, for mutual wins, mutual benefit. And there's a huge, huge canvas of space for us to work there. That's a logical, intelligent place for us to be spending our time.
I know we're past the time that we had carved out for this interview, but if you'll indulge me, one last question. This weekend marks the start of the last week for Prime Minister Justin Trudeau as Liberal leader. I'm curious if you can share with us what you think his legacy will be on Canada and any other reflections on the last 9 years of Justin Trudeau in power.
Well, it's always hard to say, isn't it? In the moment that you're in, we're always thinking about what we're doing right now. So when I think of the Prime Minister's legacy, I think of the things that are happening right now. So I'm thinking about these Pharmacare deals and dental, and I'm thinking about $10 a day childcare and national school food. I mean, I think these will all be very big. I think his legacy in the area that I'm working with, his support on health has been absolutely extraordinary. We've made more progress in the last 2 years in health, with some of the biggest changes since the advent of national health care in this country. So, but you can also take a look at his incredible leadership during COVID. We have one of the best pandemic responses in the world, and his leadership and his steady hand on that was absolutely remarkable. And so the list goes on. And so I don't know, 10, 20, 30 years where that will be. But I think, Canada has been made so much better. So many people have been helped as a result of his leadership. And it's been a really incredible thing to be given the opportunity to work alongside and with him on so many of those issues.
Minister Holland, thank you so much. I really appreciate your time.
Thanks so much, Cormac.
That was Federal Health Minister Mark Holland speaking with me about signing the first provincial Pharmacare deal and how tariff threats from U.S. President Donald Trump may impact the medications and medical supplies Canadians rely on. I'm Cormac Mac Sweeney, and that was The Big Story. You can send us feedback on this episode or any other episode by emailing us at hello@thebigstorypodcast.ca or leave a voicemail at 416-935-5935. You can find us on the Seeker app or all your favorite podcast players. Please rate, review, follow, and share. Thanks for listening.